Hi. Hi, everybody. Happy to be here. So I'm Kirill, the CTO and co-founder of xAID, where we are developing AI for chest, abdomen, and pelvis emergency cities with strong opportunistic screening capabilities. So the challenges are clear. There are shortages of radiologists all over the world. This leads to staff burnout and misdiagnosis. Up to 67% of clinical directors emphasize these problems. And because of that, up to 51% of medical reports contains at least one missed pathology. And because of that missed pathologies, clinics lose up to 150 euros per each CT scan of additional revenue. So AI can help in different use cases. Some of them is about prioritizing and triaging the patients. This is offered by a lot of companies in the field, for example, by that who are looking for stroke and head CT. But besides this, very important thing is to find non-acute and supplementary findings that usually can be easily missed by radiologists during the emergency examinations. For example, imagine the situation when somebody comes to emergency departments with rib fractures. Radiologist has 5 minutes and 60 patients more tonight to process, so he will be precisely focused on these rib fractures and can easily miss, for example, coronary calcium, adrenal lesions, or osteoporosis. But they also should be treated and followed up properly. That's the place where AI can play its game, and it is also a very important thing to add to AI products. So here are the several AI workflow schemes. Let's start with the one where there is no radiologist in place in the clinic. So in this case, usually after a CT is acquired, it is being sent to teleradiology company. But here, AI can take place before that teleradiology. We can use it for triaging the patient and look for if there is some important pathologist, and if there is no important pathologist found, we can send it to emergency room physician without sending to teleradiology. And if everything is okay, we can just discharge this patient. This will lead to average emergency room length of stay decreasement, and besides that, will hugely decrease costs on teleradiology usage, because now not every CT goes there. So the second variant is when the radiologist is in place, and here, AI can help, for example, with triaging the patients to select the most severe injured ones. For example, when the car accident happens and like 4 patients coming simultaneously. And besides that, AI also provides pre-populated medical report for each scan, so we can optimize radiologist time. And as I already told you, because of the opportunistic screening capabilities, we can find additional findings such as coronary calcium, osteoporosis, adrenal lesions, lung nodules, a lot of them, which should be after that followed up. This way, we hugely improves patient outcomes, and besides that, creates additional revenue streams for the clinics. Yeah, and now about our product, it's not a black box. Actually, we provide pre-populated medical report for each scan that can be seen at the bottom, and besides that, as you can see, we provide all types of segmentations, detections, and estimations. So here is the example of estimations of ascending and descending aorta, segmentation of hydrothorax, and the good example of vertebral fractures with osteoporosis both. In addition, we provide work list prioritization for hospitals so they can select the most severe and injured patients first. Yeah, and here's the list of the findings. Here you can see that besides only finding emergency type of pathologies such as rib fractures or vertebral fractures, as I already told you, we're capable of finding different types of pathologies that are not of an emergency type, but that should be found and treated properly. And at once, by our product, we can find up to 18 different pathologies in just 5 minutes. So based on our internal analysis for CE mark, for average Eastern European hospital, we are able to grant and enable the 6-minute time reduction in reporting, which leads to overall 24% of time savings for a clinic. Our average turnaround time is less than 5 minutes, and we're compatible actually with every DICOM and PACS vendors, so we are completely seamlessly integratable within the hospital workflow, so there is no need of installation of any additional software, and our output can be adjusted for clients' needs and easily customized. We already acquired our medical device regulations in Latin America and Central Asia, and here is some testimonials from our happy partners. And now we're seeking for clinical partners in EU as we have just stepped into the market and looking for strong partners here. Yep, thank you very much.